Hello everyone. Hope you are in the best of your health and spirits in these terrible times of lockdown. You are away from your class for quite a long time. So Dr. Saswata Biswas, on behalf of Forensic Medicine Medical College Kolkata, welcome you all to this series of e-lectures, which will continue now. Topic of my today's discussion is thermal injuries, which is a new section of your chapter, and we'll continue with this lecture for a few more e-lectures. The objectives of my today's study are after the end of this class, we should be able to classify thermal injuries, describe the local effects of injuries due to the cold, describe the pathophysiology of generalized hypothermia, describe the autopsy findings in a case of death due to hypothermia, and also able to describe the circumstances and medical legal importances of death due to hypothermia. So let the class begin like this. Let's discuss what how can we classify these thermal injuries. So basically, it's quite easy to classify thermal injuries. Either it can be due to exposure to cold or it can be due to exposure to the heat. And again, both of these can be of two types. Either they can be due to the local effects or the generalized effects. And the local effects of the cold are mainly composed of two things: where tissue freezing occurs and where tissue freezing does not occur. Where tissue freezing occurs, it is known as the frostbite, and where tissue freezing does not occur, it is known as the trench foot. And the generalized effects of cold, these are known as the total umbrella terminology, which is known as hypothermia. Again, the local effects of heat also can be classified into the two types. One due to a moist heat, which is a scald, and one due to the dry heat, which is also known as burn, which is quite known to every one of you. And the generalized effects of heat can be classified into heat stroke, heat exhaustion, and heat cramps. Now let's discuss about this local effects of exposure to the cold. What happens actually? So there are two terms which you will find in your book. I am not going to be getting into the details of the book, what is written in it. One is a frost nip and another is a frostbite. So both this frost nip is something somehow where it's a reversible condition. And when this condition becomes irreversible, it is what is known as a frostbite. Uh, uh, Basically, they occur when the temperature is sub-zero, and it's commonly seen in mountaineers, expeditionist who goes like that into this, and these are due to the localized effect of it. What happens basically in case of frostbite? Ice crystals are formed in between the skin and also in the deeper tissues. Then these exert osmotic pressures which causes water to move away from the intracellular spaces. As a result, there is swelling of the tissues in the extracellular spaces, and also there is intracellular dehydration of the tissues. And ultimately, there is necrosis of the tissues, and the tissues gets blackened. There may be a formation of blisters, and ultimately, again, there may be auto amputation of the distal parts. So, where they usually occur? They occur most commonly in places which are farthest from the source of heart. That is in the extremities, where you can also usually see the cyanosis in the tips of the digits, in the tip of the nose, and also in the tips of the toes. This type of frostbite are most commonly seen. Mostly seen in sub-zero temperature in the expeditions to the Arctic, Antarctic, or to the expeditions to the Everest. These are seen, and when this condition is reversible, that is, this process has started to occur. But if you put the fingers in warm water or bring the person to the hospital and put him to certain warm temperature, put warm blankets around him, the effects go away. And in that condition, this reversible condition is known as frost nip, and when it goes to the irreversible state, it is known as the frostbite. So, in very short, this is what is the local exposure of cold which occurs when this is a situation where tissue freezing occurs. And the other one is where tissue freezing does not occur. So this non-occurrence of tissue freezing, but there is extreme changes to the skin due to very low temperature. This is not a sub-zero temperature. The temperature is usually between 6 to 8 degrees centigrade. But what happens? The person is in water or in certain trench. The word trench foot has come from the word trench. This is typically an this word has typically appeared during the World War One, when there were many fightings in the trench. Trench fightings were there, and the soldiers were present inside the trench. which were damp, shallow, and they had to stay in long time inside. And when they came out of there were cold temperature, and when they came out of those trench, they faced these conditions in their foot. And these were basically effects of cold, and it usually superadded with some parasitic infections, superadded with some fungal infections, and also certain bacterial infections. This strange foot or rotting of the foot, also known as jungle rot, this usually used to occur. And the other terminologies of this strange foot is also known as the immersion foot. There are another term which is reversible condition of this particular trench foot, or which when occurs only in the extremities, that is known as the chill bends. And when the fingers are all and extremities and only the fingers are present, this is known as chill bends or pernio. And when whole of the foot is involved, involving the not only the toes but whole of the foot, it is known as the trench foot. This is what a trench foot looks like. There are typical blisters on it, reddening, and it looks like a typical fungal infection. And there are open sores, there are fungal infections occurring in between. To a forensic pathologist, both these local effects of cold, this frostbite and this trench foot, are not quite important actually. People usually do not die due to this local exposure of cold, but it is required to know, because people may die due to hypothermic effects, where you can see these features in the extremities. So this is important, but as such, per se, these local effects of exposure to colds do not cause death to a person, but rather the generalized effects of it. The generalized effects of cold, or which is known as in broad umbrella term hypothermia, can lead to death in many people. And today we will discuss more and more about those things which will lead to death of these people. This generalized effect before going to this generalized effects of cold and hypothermia, uh, let us try to recapitulate what we have learned till now. Let's see what we have learned till now. We have till now talked about the effects of thermal injuries, their classification, and the local effects of cold that usually are seen. And they are divided into two types, one due to tissue freezing and one due to without tissue freezing. Due to tissue freezing, they are known as trench foot, and without tissue freezing, it is known as trench foot, and which occurs with tissue freezing, it is known as frostbite. So let's now go into a situation where there is generalized effect of cold. So what is hypothermia, or at what temperature we will usually tell it is a hypothermia? Hypothermia, it is a condition when the core temperature of the body drops below 35 degrees centigrade. Now, how do you measure a core temperature of the body? The core temperature of the body is usually measured through the rectal thermometers, and also there usually when the core temperature drops below 35 degrees centigrade, it is known as a hypothermia. Now, what can be the types of hypothermia? Hypothermia can be classified based on many things. According to the working of the heat regulatory mechanism, it can be classified into two types. One is a primary hypothermia, another is a secondary hypothermia. What is a primary hypothermia? Your heat regulatory mechanism is absolutely normal, but you have gone into such a condition, such a place, either in the Everest or in the Arctic, that you are without your gears, and you have gone into primary hypothermia. But your heat regulatory mechanism is absolutely okay. That is what is known as a primary hypothermia. But a secondary hypothermia means somehow your heat regulatory mechanism is not working properly. Certain diseases are there where your heat regulatory mechanisms are not occurring properly. The primary one and the most important being hypothyroidism or myxedema. This is an example of secondary hypothermia when your person is suffering with hypothermia. A person may also suffer from chronic alcoholism. A person may have certain infections, malnutrition, even diabetes. Their heat regulatory mechanism are not working properly, and this may lead to secondary hypothermia. So the basic difference between primary and secondary is your thermoregulatory system is working well in primary, your thermoregulatory system is not working well in secondary due to certain conditions. Again, this hypothermia can further be classified into acute, chronic, and sometimes exhaustion hypothermia also. Acute means you have gone into the small baby or an old person has suddenly been thrown out of his house to an extreme harsh temperature, or you have suddenly fallen into an extreme cold water while returning from your house, and you face an acute hypothermia. And the chronic hypothermia is particularly for old and aged people who are suffering from some diseases, who live alone in their home. There is nobody to look after, and they are suffering from certain vascular diseases, maybe from diabetes, and they are exposed to chronic hypothermia. Now, this exhaustion hypothermia is somewhat in between this acute and chronic hypothermia. Rather, to explain it in a better way, it is an exposure of an acute hypothermia to a chronic setting. The person gets exhausted due to lack of food, due to lack of warm temperature, and he had a chronic background of hypothermia due to some diseases, and ultimately he goes into exhaustion and dies due to exhaustion hypothermia. And this hypothermia can again be classified into dry cold hypothermia and immersion hypothermia. The term itself is self-explanatory. When you fall into water and there is some issue of moisture related to it, which actually leads to more loss of latent heat, it is known as immersion hypothermia. And when it is due to dry cold environment, it is known as dry cold hypothermia. Two other types of hypothermia can be classified. One is a natural hypothermia, another is a therapeutic hypothermia. Therapeutic hypothermia is nothing but therapeutic hypothermia is what is an iatrogenic hypothermia, and the natural is when it occurs due to some natural reason. Now, when this therapeutic hypothermia or iatrogenic hypothermia is very much necessary, this iatrogenic hypothermia actually may act as a protective mechanism to the person in certain disease conditions. These particular disease conditions are neonatal encephalopathy, stroke, even times of cardiac arrest, some traumatic injuries to a brain and spinal cord. They may also respond to this therapeutic hypothermia. So, by this time, we have understood what is hypothermia, what are primary and secondary hypothermia, what are acute, chronic, and exhaustion hypothermia, what to understand by dry hypothermia and immersion hypothermia, and what are the differences between this natural and therapeutic hypothermia. And next, we'll go into the stages of hypothermia. The stages of hypothermia are basically classified into three stages: stage 1, stage 2, and stage 3. Stage 1, or the mild hypothermia, it is a temperature between 35 degrees centigrade to 32 degrees centigrade. So, during this mild hypothermia, everything is normal. Your body regulatory temperature is working properly. You are having shivering, so that heat can be generated, and the core temperature is usually maintained between this time, and there is no exceptional feeling other than feeling of extreme cold. But when this temperature falls below 32 degrees centigrade, and this is known as moderate temperature hypothermia, and the temperature between 32 degrees centigrade to 26 degrees centigrade is known as moderate hypothermia. This moderate hypothermia is a phase where your shivering stops first, and after this shivering stops, the person becomes poikilothermic, and he attains the temperature of the climate or the external environment where he is placed that time. He may get depressed, lethargic, drowsy. The neck muscles also become stiff, and the gait becomes like that of drunken one. And ultimately, there is a decrease in respiration, heart rate, and BP. Certain red patches usually occurs on the skin, followed by appearances of the edema of the skin and that. And there are certain particular cardiological features which are very much important, that is shown in this particular ECG in this slide. This is when a person is in moderate hypothermia, something known as a Osborne wave or a camel hump sign is seen in lead 2 and lead AVF of an ECG. This is important because inexperienced person may think this to be an ischemic change, and this is usually occurs in the lead 2 and lead AVF. But when hypothermia is present, this is known as Osborne sign or a camel hump sign. For you people, this is most important because this come as an MCQ in quite a few number of times. And when a person goes below 26 degrees centigrade, what happens? If a person goes below 26 degrees centigrade and this temperature is maintained for a period of around 24 hours, the person ultimately dies. And what are the basic causes of death in this cause? When a person temperature is maintained for 20 below 26 degrees centigrade for more than 24 hours, initially there may be ventricular fibrillation, and ultimately that ventricular fibrillation will lead to stoppage of the heart, and there will also be cessation of all vital centers in the brainstem. However, some controversies also arise because one case is reported in the certain books that a person survived for more than 24 hours in a temperature when his body temperature was less than 18 degrees centigrade. But for all practical purposes, And for you, the stages of hypothermia are divided into three: mild, moderate, and severe. One is a stage one, stage two, and stage three. And what are the important thing? Between difference between stage one and stage two is the shivering stops in stage two at 32 degree Fahrenheit. And the hypothalamus stops functioning at 30 degrees centigrade and reaches 26 degrees centigrade. And 26 degrees centigrade temperature is important because if it is maintained for a period of more than 24 hours, the person ultimately dies. And these are all about what is hypothermia. Now let's come and concentrate on our basic thing, our autopsy findings. Per se, in all practical purposes, if in India we do not find any person who has died due to hypothermia, since this is a typical death, this type of death typically occurs in temperate climate and not required for this tropical climate. And again, it's a very difficult finding. It's very difficult to conclude from autopsy whether a person has died from hypothermia or not. Particularly, say it is somewhat like the cases of asthma or epilepsy, where autopsy findings are quite impossible to ultimately conclude that the person has died from that. And again, if a person who has suffered hypothermia and has been shifted to a hospital, the person survives for a period of 18 to 20 hours, and in after that, if the person dies and is brought to the mortuary, it is impossible to diagnose this death due to hypothermia except from the history. And this is quite a dilemma for all the forensic pathologists, whether to follow a history or whether to have only objectified pathological findings. Those are not required for you actually. What is important for you are the postmortem staining is reddish, uh, rather very red, and there are dusky red patches over the large joint areas. These large joint areas, as you can see in the photograph, there are dusky red patches over this large joint areas. So why there is dusky red patches over this large joint areas? Because these are the sites where these large joints are the sites where the person has got into local touch or local contact before the death. And there the initially the changes like that of frostbite has occurred to this person. So these dusky red areas or dusky red patches are seen. The margins are indistinct, but this is a very specific finding of hypothermia, which can be particularly observed in persons who have very fair skin. The over the extensor aspects, dark red patches are seen, which are probable signs of frostbites, and the margins are blurred. And apart from this, the whole of the postmortem staining is deep red in color, or rather dark red in color. Sometimes it is difficult to differentiate between these dark red patches and the postmortem stainings, but obviously, as you know by this time, the postmortem stainings are mostly seen in the dependent parts, whereas these dark red patches with indistinct margins can be also seen in non-dependent parts, and it is seen in the non-dependent part, particularly in the extensor aspect. There is generalized edema. Generalized edema means the facial edema is present, the eyelids are edematous, and the feet and also the palm, they may also show edema. These are due to vasoconstrictions and also exudation of fluid, intracellular fluid. This generalized edema can be seen. And one thing is seen, what is known as a cold stiffening. The synovial fluids, all the fluids inside the muscles, they become frozen, and it is very difficult to track them out, and they become very solidified and give a stiffened posture. And this stiffened posture is very difficult to break them. And there is also subsequent hardening of the subcutaneous fat. You cannot open up the fingers, and the whole of the body might be present in an extended position. Might be present in a flexed position due to this extreme stiffening. So this is what is about the cold stiffening. In the internal findings, the organs are usually congested and bright red. Eyes may cause at sometimes breakage of the skull sutures. Cytotoxic brain edema is always present due to extreme cold temperature. All the organs appear bright red at this. The most consistent finding in among the structures are the findings in pancreas. In most of the textbooks of forensic pathology says That fat necrosis is seen in about 40 to 50% of patients who die due to this particular cases of hypothermia. Now, this fat necrosis in pancreas is usually an aseptic pancreatitis like thing. There will be necrosis seen in the fat, and also at certain times there are pancreatic hemorrhages can be seen. But these pancreatic hemorrhages are very difficult to interpret actually, because after death the autolysis of the pancreas starts, and they may also show this pancreatic hemorrhages in this particular thing. And there may be depletion of the lipid layers from the adrenal, and in heart we may also find certain ice crystals within the blood, and the right atrium and right ventricle usually appears dilated in cases of heart. In lungs we may also find minute hemorrhages present over all of the lungs. Lungs will be congested with hemorrhages in the intraalveolar surfaces. And also one of the important thing to see, we may find foci of pneumonia in the lung if the patient is deceased person is chronically exposed to this cold temperature. And hemorrhagic spots may are very common in intestine and the stomach, and according to certain books they are found in more than 50 to 60% of cases also. This particular small hemorrhagic spots inside the stomach and this intestine was first discovered by Wisniewski, and it is also known as Wisniewski erosion or Wisniewski spots. These are more similar to like that of stress ulcer, but the points are much more minute, and it is present all over the stomach and also in the intestine. Hemorrhages may also be present in the layers of the meninges, and regarding the postmortem biochemistry, the blood glucose usually appears to be increased in all of the body fluids, including the vitreous in cerebrospinal fluid, and there are increased catecholamines in the urine, and we may also find that the carbon dioxide this glucose concentration and the carbon dioxide concentration usually varies inversely with that of the temperature. Oh, I have been talking a lot. By this time, most of you must have got bored. But this was all about today's finding, or rather today's class. I will not talk more about this. We'll end up. But before ending up of the class, there are one more thing to discuss, the medical legal importance of this thing. And this medical legal importance of the hypothermia are basically this deaths due to hypothermia are mostly accidental. However, homicidal exposures can also occur, particularly in case of neglected elderly people, and also in case of neglected neonates. They may be thrown out, and these are acts of omission which may ultimately lead to death. So, in that case, homicidal death due to hypothermia can also occur. Two terminologies are important here. One is known as a paradoxical unbracing, and another is hide and die syndrome. Paradoxical unbracing means a person is when the thermoregulatory control of the person is lost, he starts to feel warmth when the external temperature is even very hot. Even very cold, the person begins to feel very hot because there is cutaneous vasodilatation, and as the thermoregulatory system is not working properly, due to this cutaneous vasodilatation, the person feels a sense of warmth, a false sense of warmth, and when he feels this false sense of warmth, he opens up the desses, and in a scene of death due to hypothermia, where death has occurred due to hypothermia, persons may be found almost naked or semi-naked, and in a setting of a very cold temperature. That may actually lead to a wrong interpretation in many police inspectors and also to some non-experienced forensic pathologists, that some offense, some homicidal thing or some sexual offense, some rapes have occurred. For that reason, the person has undressed, but actually it is not like that. This paradoxical unbracing is due to the loss of the thermoregulatory mechanism and misinterpretation of the person regarding the external environmental temperature. Another term is known as a hide and die syndrome. The crime scene is usually very distorted. Everything is outside. The clothes are thrown outside. The books are thrown outside, and the person is usually found inside a closet or inside the chimneys, working of chimneys, the person has died and ultimately have died. This is also typical seen in old person who are mentally disabled, who are chronically suffering from malnutrition, or they are suffering from certain metabolic diseases, and also in extreme temperature, there is loss of their cerebral function. They cannot walk properly. The cognition of the person gets lost, and ultimately they may walk away, they may walk into some closet and try to hide and ultimately die there. That is what is known as a hide and die syndrome. So this is all about the medical legal importance of the death due to hypothermia, and I will not discuss anymore today, but rather will go back and end the class here. Too much, it's not too much, I think, because usually the classes are 1 hour. Today I have discussed only for 30 minutes. But before leaving, I just want to give you certain tasks. The first task being, how do you differentiate between a cold stiffening and rigor mortis during autopsy? Think when you are reading, when you will be reading. It is present in all textbook. It is very easy how to differentiate between this cold stiffening and rigor mortis. But try to think before looking at the book how to differentiate between this cold stiffening and rigor mortis. The second question for you is why this postmortem staining is deep red in deaths due to hypothermia? This is again a sitter. If you remember your physiology classes, okay, let me give you a hint. It's a physiology class, something related to oxygen dissociation curve. So this postmortem staining is deep red in this color. And another task for you. How does this Wisniewski spots? I haven't shown you any picture. How does they look macroscopically and also look microscopically? And for any question, any concern, or any comment, kindly mail me at this particular email ID. And I also want your answers in this particular email ID with two photographs of my one of a macroscopic feature of Vishnu whiskey spot, another of microscopic feature of Vishnu whiskey spot. That's what I want in my email from everybody of you, those of you who will be attending these classes. That's all. Thank you for today. We hope to meet you soon. We hope to meet you in the lecture theater, in the GLT, in a healthier world. Thank you. That's it for today.